Morning. My name is Adriane Rogers, and I am currently serving as the Executive Director for the Pasco County Mosquito Control District. In the 18 years that I've been in the Florida mosquito control community, I've spent a lot of time trying to effectively communicate to a variety of different audiences on mosquito biology and ecology, the protection of public health through vector control, to spread awareness for mosquito-borne disease, and to promote integrated mosquito management techniques. Today, I'm hoping to impart some of that wisdom that I've learned throughout the years and discuss some of the challenges that we face in conveying a science-based technical operation. Thank you. As a brief overview, you gain an insight and understanding of how to communicate effectively mosquito control strategies, especially in the context of public health pesticide use, environmental considerations, and fiscal responsibility. Next slide, please. Community engagement is tremendously important when trying to effectively communicate about vector control. For those of you who are trying to convince jurisdictions of the necessity to start a mosquito control program and the importance of providing that vital public health protection to your citizens, and trying to get the buy-in of policymakers and other community leaders within your area, to those of you who may already have a well-established program looking to remain relevant and keep the public's trust, educating individuals at all levels within your community is key. The public plays a crucial role in support or even opposition of our vector control programs. Lack of awareness for the role mosquitoes play in public health and misunderstandings about mosquito control efforts can lead to challenges and resistance against your program and the services that you're trying to provide for the betterment of your citizens. Being open, honest, and transparent, and engaging with your community early and often builds trust, increases public understanding of your methodologies, and leads to a much more collaborative and cooperative arrangement in successful mosquito control programs. Next slide. At our program in Pasco County, Florida, we utilize a well-balanced, science-based approach and best management practices for mosquito control and employ a fully comprehensive integrated mosquito management regime. So what is integrated mosquito management? I heard one of the prior speakers sort of gave an overview of this already, but integrated mosquito management is a comprehensive approach to mosquito control that combines a variety of different methods: surveillance, monitoring mosquito populations, actively looking for mosquito-borne disease presence, source reduction or eliminating mosquito habitat, biological control using natural predators on mosquitoes like gambusia fish species, or using biorational larvicides such as BTI, to target mosquitoes in that immature stage before they become flying and biting adults and have the potential to be a major nuisance or spread deadly diseases. Chemical control using targeted pesticide applications by ground or by air. Public education, inform the community about the importance of mosquito control efforts in protecting public health and how they can prevent mosquito production and protect themselves from mosquito exposure. Resistance monitoring to ensure that the chemicals that you're using are actually going to remain effective at killing mosquitoes and so that you're not wasting your resources. New product and equipment testing, looking for innovative strategies to add to your program. Using an integrated mosquito management approach is a scientifically proven, environmentally responsible way to combat mosquito-borne disease. Next slide, please. Mosquitoes are, for humans, pets, and livestock, at best an annoyance, at worst, vectors of very deadly diseases. Next slide. We often face the challenge of dealing with people who dislike pesticides. This can be due to concerns about the potential health risks, environmental damage, or the impacts on beneficial insects and ecosystems, which can lead to desire for safer, more sustainable mosquito control methods. This challenge always boils down to balancing public health with environmental sensitivity. Most people don't know the mosquitoes' involvement in vectoring diseases like dengue, West Nile virus, Zika, Eastern equine encephalitis virus, and other serious life-altering conditions. You have to first inform the public about these diseases and the magnificent menace that is the mosquito. Vector control programs are essential to protecting public health and preventing the spread of these diseases. But we also must be environmental stewards and control mosquitoes responsibly, while not causing undue harm to ecosystems or other organisms, especially things like beneficial pollinators. The products used for mosquito control, the amount of product used in mosquito control applications, the timing of applications, use of bioactive pesticides like BTI, these are all things that you really have to convey to the public and inform them of. We're not just out there indiscriminately spraying pesticides and killing everything within our paths. We're much more selective and responsible than that. When people express concerns about pesticide use, you have to be open and honest with them. Tell them about the steps that you take to address these commonly misunderstood issues. Tell them how the timing of the applications, the use of ultra low volume spray to kill adult mosquitoes. With the time that we're making those applications, bees and butterflies are not out foraging, and therefore they're not being impacted by the application, as an example. Explain to people how modern vector control practices use precision GPS-guided mapping systems that can reduce drift potential to non-target areas, or that the amount of chemical used to kill adult mosquitoes equates to 2 ounces or a shot glass full of chemical per an area the size of an entire football field. Next slide, please. It's also important to be transparent about your operations, show fiscal responsibility, and be good stewards of public funds. As vector control programs, you're likely funded through some form of public funding mechanism, just as the programs are here in the state of Florida in the United States. And we have limited resources, of course. You must do what you can to maximize the effectiveness of those limited resources. Communicate the challenges with the public that you have with those limitations so that they can see how you're managing programs and can provide added support. Stress the importance of efficient and targeted control methods and use new technologies and innovative strategies to increase those efficiencies. Inform the public that surveillance and community input are both important considerations in allocating those very limited resources most effectively. You have to have a pulse on the ever-changing and evolving needs of your community. Where I'm located in West Central Florida, our community is one of the fastest growing counties in America right now. And as more people are moving to the area, more communities are being developed, the landscape is very rapidly changing, and so are the dynamics of the people that are now occupying this area. You have to regularly engage with your stakeholders to understand how things are changing and adapt to those changes appropriately. You cannot remain stagnant. You must balance the cost of operations with those evolving needs. If you're transparent with how you're spending the money, then the community will see your constraints and they'll have a vested interest in increasing those funds or helping you to increase those funds to promote public health initiatives in combating mosquito-borne diseases. I'm fortunate to have some incredibly talented craftsmen on staff and the facilities to be able to service, maintain, and even fabricate equipment. We build equipment in-house, which translates to a significant cost savings to the public. If you're able to do that, if you're able to build equipment in-house or work on your equipment in-house, highlight those initiatives and the successes that you have in doing that. Tell your citizens about the ways that you're able to save them money by being responsible and taking cost savings approaches to your operations. Another great way to enact cost-saving strategies is to partner with other agencies or local community groups for education or to share resources. We all have constraints and limited resources, and if we can pool those very limited resources and work together so that we're not duplicating efforts, that really helps and goes a long way in reducing some of the costs to your own organization. Next slide, please. Addressing the public's concerns is important in communicating pesticide use. Being open and honest about the products used, the amount of product that you're using in an application, the timing of the applications, what to expect, all of these details are important to help you set the appropriate expectation with your community. Talk about the research that's been done on the products that you're using. Talk about the label, specific requirements. It's the preponderance of scientific evidence that's important. We've got keyboard warriors these days that can always find something, one single piece of what they're calling evidence to support their line of thinking, but that really doesn't mean that's the most appropriate piece of evidence. It's certainly may not even be remotely factual. And so, there are numerous non-target studies on the chemicals that we use for mosquito control available. There are even more studies on the effectiveness of those products and how they work in controlling mosquitoes that are readily available. Use that information. Point to that information, and when people express those concerns about pesticide usage. Also, be sure to bring the conversation back to protecting public health. With over 700,000 people dying annually across the globe from the bite of an infected mosquito, and hundreds of thousands more that are impacted by mosquitoes, this is the necessity for mosquito control applications. And this is a consistent message that you should be using in all of your interactions with the community. Always bring it back to the protection of public health. Stress the importance of using chemical control methods in addition to all the other tools that you have at your disposal, and to reduce mosquito populations, again, for the protection of public health. Stress that importance. Offer clear and concise explanations as to the regulatory process and the rigorous screening that's conducted on pesticides before they're available for us to utilize. Create educational materials for distribution that are easily digestible by the general public. The layperson who very likely does not have a scientific background, don't use mosquito-specific jargon, or they won't understand what you're trying to communicate. There are specific terms we use: larvicide, adulticide, integrated mosquito management. These are not commonly known terms, and so you really need to make sure that you're using language that they can easily understand. Be concise. Use simple language and visuals to explain these complex issues that we're using for mosquito control. If you don't have time or the staff to create educational materials, use some of the resources that are already readily available out there for use. The American Mosquito Control Association, as an example, has some really great flyers, handouts, other educational tools that you can utilize, as well as other organizations like the WHO and others. And so you use those materials that are already available. You don't have to create your own material or reinvent the wheel, especially for those of you with very, very limited resources and small staff. Create a website for information. Utilize social media platforms to reach a larger audience. Hold community meetings or virtual workshops like the one we're doing today. Allow citizens to ask questions and seek their input. Next slide, please. You need to build community awareness and education programs. An informed public is a supportive public. You have a lot of knowledge to impart on mosquitoes, mosquito control, and your specific operations. Tell your story and educate your community. Engage the public and inform them that they have a personal responsibility in protecting public health. Teach them how to prevent mosquito breeding habitats around their homes and businesses by emptying water holding containers. Instruct them on the appropriate use of insect repellent and other personal protective measures that they can take to limit their exposure to mosquitoes. Build that website, use social media platforms, engage the media to share information. Host or participate in community events, set up a table with displays and flyers, some promotional items, even just business cards and a flyer stating who you are, and just get them to your table and start an open conversation and just start communicating with them. Inform them of what you're doing there and how you're providing this vital public health service in the community. Bring people to your facility. Show them firsthand what you do to protect public health. At my program in West Central Florida, we offer tours of the facilities like the one here in this picture. This is through our educational trailer. And we seek opportunities to get in front of the community at various group opportunities, such as school groups, summer camps. We talk to civic groups, government organizations, homeowners associations, other networking groups, really anything that you can get in front of a group of your constituents or other stakeholders in your community to inform them about the importance of mosquito control and what it is that you do specifically with your program. Excuse me, next slide. To be effective in your messaging, you have to dedicate time to positive messaging. Again, the focus should always be that mosquito control efforts protect public health. Start there. Build messaging around that core concept. Create content that's engaging and educational. Use things that are relevant in your community. If you attend events or have speaking engagements, create posts about your involvement in those community events. Show them that you're engaged and invested in the community and a part of the community, and really have that interest in protecting public health. Most importantly, listen to your citizens. Seek opportunities to collect feedback so that you can make improvements to your operation. Address concerns that you hear about by showing how their feedback impacts the decisions that you're making operationally. Here's a screenshot from my program's Facebook page. Just a simple plug there. Go ahead and follow us. Pasco Mosquito is where you'll find us. And we aim to educate and inform. We have short videos from the staff about different mosquito species. This is the mosquito of the month that we started recently. Our entomologist gets on and talks very briefly about a specific species every month, just to, again, educate the public. We talk about disease situations or hurricane recovery efforts. We post photos of staff participating in community events and hosting facility tours. We spotlight staff and their outstanding achievements. Try to create content that is of interest to the community and relevant. Try to make it a little personalized so that there's a human aspect in what we're doing. We're people too. Try to make it so that they have some sort of connection and vested interest in what you're doing. Excuse me, next slide. Community engagement works. Involving local stakeholders is effective at spreading awareness. Establishing those connections early and under normal operational situations is really key. Last year, within my jurisdiction, we had locally acquired dengue virus cases. And during that situation, when we first learned of it, I wasn't panicked to try to figure out who do I need to contact with the Department of Health? Who do I need to contact to get messaging out? I already knew which person at the respective agencies I needed to connect with because I already had established relationships ahead of time with these individuals. During the emergency is never the time to try to find the right person that you need and make and establish that connection. We really need to put in some legwork ahead of time so that when the emergency situation arises, it's a lot easier to control messaging. It's a lot easier, smoother transition to effectively perform your mitigative response when you know exactly who to contact at what organization or agency. As a result, the need for increased communication and the spread of community awareness for what we were experiencing with locally acquired cases of dengue, we created a working group called the Pasco One Health Alliance. So this is just an example which brings together the local health officer, mosquito control, emergency management, animal services, local hospitals and veterinarians, human services, homeless coalition, a variety of different stakeholders that have some involvement in human, animal, or environmental health within Pasco County so that we're all working together. We can communicate effectively. We can share vital information during these emergency situations, inform them that we have local transmission of dengue, inform the physicians that they need to start actively looking for people coming into their care, seeking care with symptoms that are consistent with dengue, because that dengue is not considered endemic in Florida at this time, and so they're not actively looking for dengue. And dengue has symptoms that are very similar to many other things that we do commonly have here in Florida on a consistent basis. And so we're missing a lot of those diagnoses because there may just not be informed to look for it. And so this is a great opportunity for us to share that information so that the local medical community is actively looking for it. We have quarterly meetings to educate the members on these important issues, the services that we provide, and to share information. And we only have so many people that view our website every year or follow us on social media. But if you put together all of these different stakeholder groups, the reach that the potential for spreading that information and disseminating it to the community is much, much greater when you're combining all of these resources. And so we can help share each other's information and get that out to a much larger community base more effectively and much more expeditiously in overall protecting public health within our community. This has proven to be a successful approach for us and has worked in our area, and it's something that we're going to continue to pursue. Next slide, please. Challenges in engaging the community and effectively communicating about the importance of mosquito control and your operation will most certainly arise. Misinformation will inevitably be spread, but it's how you deal with that misinformation that matters. Excuse me. You have to combat misinformation using facts and be very clear in your explanations. Again, you want to bring that messaging, you want it to be concise and easily understood. Don't use terms that are specific to mosquito control because, especially during an emergency situation, you want your community to understand what you're telling them and how they can mitigate the risk. And so you want them to understand what it is that you're talking about. Rely on local media to spread messaging quickly. During disease situations, I put out press releases. I do this to try to get ahead of the situation and control the messaging. I want to be the one telling the story because I'm the one that has the facts. I know what it is that we're doing operationally. So I put that message out to our local media community to inform them of the issue. For example, when we had the local transmission of dengue virus last year, we had cases identified. I wanted to spread awareness about the risk of further transmission, to inform the public of our increased control efforts in these areas so that we could combat the spread of dengue, and to educate people on preventative measures and limiting their exposure to the dengue vector mosquito. When people push back, keep your cool. That's tremendously important. Try to de-escalate any situation if tensions are high, and provide scientific evidence and the facts in your response. You have to be patient, you have to be respectful, open-minded to address the concerns that they have. If you don't know the answer to something, don't make up an answer. That's certainly the worst thing that you could do in the situation. You want to provide solely the facts and information that you know. Again, always bring it back on focusing on public health. Next slide. In summary, I hope that you found this presentation to be a comprehensive, approachable framework for introducing effective communication strategies for mosquito control and helping to understand both the challenges and some of the best management practices for engaging your communities. Key points to remember: effective communication builds trust, it fosters community support, and helps ensure the success of your mosquito control program. Integrated mosquito management is about using a variety of tools, with pesticide use being merely but one of those tools available for use in the larger picture. Transparency, education, and community involvement are crucial in addressing concerns about pesticide use and environmental impact of integrated mosquito management program. Collaboration and careful stewardship of public funds are both essential for building sustainable, effective vector control programs. And lastly, always approach mosquito control as a shared responsibility. The public, local government, vector control professionals must continuously work together for the overall health and safety of our community. Everyone has a role to play, and that's vitally important in harnessing those relationships and utilizing some of those other stakeholder groups. Last slide. And with that, I very much appreciate your attention this morning. Thank you so much.